So with that, I think we'll move on to our next presenter. And I have worked with Cathie in the past, and she's a great presenter and certainly very thorough in her approach. Cathie has extensive experience in the public and private practice and aged care sectors. This includes working in primary health care for the last 18 years. Cathie is a registered nurse and a certified practice manager, having managed both semi-rural and urban practices. So there'll certainly be some differences, insights in that, Cathie, whilst continuing to manage a multidisciplinary GP practice and specialist obstetric practice. So once again, some very, very different workings in how those two practices go. Cathie has held positions with AMA New South Wales and as practice manager advisor, and is the academic director of the medical practice assistant program with UNE. Cathie is a firm believer that practice managers are key in the development and delivery of strong systems of leadership management, enabling the delivery of quality care in Australian primary health sector. And I have to concur with you, Cathie, a very good practice manager makes a massive difference to a practice, because whilst you could be there looking after patients, someone else needs to be there running the back end or the front end of the practice. There's lots of systems, procedures, and issues that every practice does on a day-to-day basis. We just talked about marketing as one of them. The multi-hats that a practice manager must have certainly means there's plenty of challenges to overcome. And I'll pass over to Cathie now. Thank you.
Thank you, Jared, very much. And welcome everyone to this afternoon's session. My name is Cathie Baynie. I'm the Executive Manager of Advocacy and Professional Services with AAPM. I'm just going to start sharing my screen with you if I can. There we go. From beginning, that was supposed to be. Okay. So as I said, I am the Executive Manager of Advocacy and Professional Services with AAPM. AAPM is the peak professional body for practice managers in Australia. We work with government to advocate for our profession, and in a lot of advisory capacities with the Primary Healthcare Division, with the Australian Digital Health Agency, and with Human Services as well. So with Medicare, we're often consulted for our opinion on policies and strategies as they are put in place. We provide ongoing education and upskilling for practice management, as well as education, critical communications, and a host of member services as well. Okay, so AAPM describe the core principles of practice management as these under these 8 headings. So as you can see, it's a varied and complex role that has a strong focus on compliance in such a heavily governed industry. Healthcare practices, as we know, are faced with ever increasing complexities, and having a practice manager will ensure efficient and effective business and operational decision making. If we drill down into the role of a practice manager a little further, these are the 10 pillars which we use to describe the role of practice management. I don't have time to go into all of them today, so we're going to have a quick look at some of what I see as the key roles. And it's really important, given such a varied and wide scope, that your practice manager is constantly upskilling and staying connected with the industry in order for your practice to be agile and responsive, and to be able to embrace the opportunities as they arrive. I just wanted to pick up a little bit on operational financial management, because I know that we're here today on a conference with the experts. So when I talk about financial operational management, it's things like a fee setting strategy. It's really important for your practice to have a fee setting strategy, and not just to grab random numbers at random times out of the ether. You need to know your demographic well. You need to know and be able to cater to their economic situation. You need to think about when is a good time to increase fees and by how much. And often that aligns well with any changes in the MBS from Medicare. But a good fee strategy will be will be quite complex and tiered. Gone are the days when it's when we're able just to have either a private fee or a bulk bill. It's really important to have a comprehensive fee strategy that does address the needs of your patients, and to use that fee strategy as a marketing tool to train your staff to be able to shift patients through different fees. And by that I mean you might have a frequent flyer fee for a patient that's been coming to the practice regularly because they're unwell. You might have a loyalty fee, and every now and then you might toss that in for some of your long-term and loyal patients. So you need to think comprehensively about a fee strategy and not just have one or two. The other benefit of that is when it is time to increase the fees, it's not quite as obvious a big fee gap, because you are shifting patients through a tiered fee strategy. And our software lends well to us for us to do this. And you can actually input the fee that you want the patient to be charged through your software before the patient actually reaches the front desk. All right, I want to talk a little bit about business planning. Business planning, and it's probably come through many, many times throughout the conference today. But you need to step back from your practice and take time to plan for success. A business plan drives the execution of the strategy, and it keeps your business focused on the vision and the purpose of why you're there. More importantly, a practice manager's role in your business plan is that it's not a set and forget activity. It needs monitoring, it needs reviewing, it needs nurturing. Your staff need training. They need to have buy-in. So your practice manager will be able to understand your demographic data. She will be able to understand the skills and the scope of your staff, bringing those things together to form SMART goals for your practice. And by SMART goals, I mean goals that are specific to the needs of the communities in which you are located. They are measurable in terms of both business outcomes and patient outcomes. They're achievable, they're relevant, and they have a time frame for completion. So your practice manager will bring all this together to ensure that the services that you deliver are meeting the needs of the communities in which you are located, and utilising your staff to the top of their scope, which in real terms is to the top of their dollar as well. Let me give you an example. In one of my practices, I had a nurse that came to me and pointed out that we had a lot of new mums. We had a lot of mums and bubs in our demographic, in our patient database. This nurse happened to be a midwife, and she said, I think that there may be opportunity here for us to develop a service that we don't already have. And I'm like, and that's a great idea. Love developing new services. So she actually wanted to introduce baby massage classes into the practice. So we sat down and we planned it out, and we scoped it. So part of that plan, well, how's it going to work? What is our costing going to be? And obviously you set your base at what your cost to actually deliver it is, and what you want your profit margin to be. What risks there may be in delivering this new service. And some of those risks we identified were that if we were going to hold it as classes, there was a risk that maybe we wouldn't get enough attendees to actually cover costs. So what we did was we opened it up to non-patients of the practice as well, to try and mitigate that risk. So needless to say, the baby massage classes were a great success. And then we actually offered them one-on-one as well. So we diversified the service. After we reviewed it, we realized that some people actually wanted a more tailored approach and a more one-on-one experience. So we offered them in both formats. When COVID arrived, we were extremely agile, and we took these classes and these baby massage lessons online, on Zoom, and it was extremely successful. When we were reviewing the service, just to make sure we were on target, and our costing was on target and our budgets were on target, the nurse said to me, the only problem is I can't get them offline. They're so isolated and they're so desperate to chat. I just can't finish up the session on time. And I said, that's not a problem. That's an opportunity. So we now deliver weaning and commencing formula, and also starting solids. So we have now, that service has grown into 3 different offerings, utilising the skills of my nurse and building our patient database as we go, because some of those patients that attended the classes are now patients of the practice. And I think the moral to that story is, don't let the MBS define your business plan or your business goals. There are many services that you could offer outside of the MBS. Certainly, maximising the MBS and utilising it well will be part of your business plan, but don't let it define you. It is only one part of your business plan. And so a good practice manager will look for opportunities beyond the MBS, utilising all available resources and staffing skills. All right, another key role for practice managers is operational performance and efficiency. Again, setting systems and processes in place is not a set and forget activity. It's really important that these systems are regularly reviewed and monitored to make sure that they are efficient. They are delivering what they're intended to deliver, and you aren't overlooking any other opportunities that might be available to you. I think one of the key performance indicators for a practice manager is that the clinicians of the practice have safe and efficient systems in order to deliver great patient care. And another big one, of course, is human resources. Human resources is a really complex, and it can be very tricky. Practice managers need to be across all components of fair work, work health and safety, and a raft of other compliance along the way. It's really important that this is done well. AAPM have a HR advisory service, which is a member service. So anyone who's a member of AAPM has access to a very comprehensive HR advisory service to keep you on track, keep your business safe, and keep everything in line. Apart from that, your staff are one of your biggest costs. So a good practice manager will make your staff one of your greatest assets. Your staff need good leadership. They need management, they need good leadership, they need extensive training. And once again, training is not a set and forget thing. Our industry, our environment is constantly changing, and it's really important that our teams are kept up to date, whether it be with marketing, customer service, privacy, triage, confidentiality. There is so much training that has to happen. If you think about the fact that your reception staff are the first touch point for your patients and the last touch point for your patients, marketing becomes really important. And the way that they contribute to the service delivery in your practice is really important, and they need to be well trained to do that. Our industry is also in a very strong environment of change, and change management isn't easy. It takes a good practice manager to bring the team along the journey through any change, whether the changes are internal or whether they're external and being forced upon the business by external forces. It is really important that your team and that massive investment that you make in your staff have good leadership. Okay, so by very nature, practices are really busy and reactive environments. Without a practice manager, your team and your staff potentially look like this, all over the place, every day, just trying to get the day done and meet the demands of a busy practice. You could also think about it a little bit like this. Unfortunately, if the practice is not well organised, if systems are not streamlined and efficient, then perhaps that is what it is like, and the sustainability and viability of your practice becomes a little concerning. With a practice manager, your team, you're all marching in the same direction, all headed towards the same goals, absolutely in step with each other. Or maybe you'd like to think about it like that, because one leads to the other. Professional practice managers excel at all the core responsibilities that we've been through today. They embrace and lead change, and they think like a clinician and a business person. The two cannot and must not be mutually exclusive. It's really important that your practice manager is cognizant of both those outcomes in any practice. Jared, I'm happy to take questions at this point in time.
Okay, great. So I've actually got a couple, because I think one of the biggest challenges in practice is actually finding a good practice manager. So do you have any tips on how to find a good practice manager for your practice?
Tips. Well, as I said in the presentation, it is really important that your practice manager is connected to the industry and constantly upskills. So obviously being a member of the peak profession is probably a really good start. We're seeing practice managers come into the role now from all walks of life. Some of them are coming with, MBA qualifications, but we still have, situations where the senior receptionist may step up into the practice management role, certainly in small practices. Regardless of the background, it is really important that the practice manager is constantly upskilling and constantly staying abreast of the changes, especially with regard to compliance. So we AAPM, you can advertise through us to look for a practice manager. We do that. That is something that we do offer.
So in a lot of practices, we start out from a humble beginning and we have reception, maybe a part-time nurse and a couple of doctors trying to get everything off the ground. And we love our receptionist who has aspiration. So what could be the path that we could put them on to grow as we grow?
That's a really good question, and it's an interesting one for me because I started out life in primary healthcare as a nurse. A registered nurse in a practice, and I loved my role as a registered nurse. I think perhaps I was just the one that didn't run fast enough when the practice manager left. Study is important and qualification. So I went back to university and did a diploma of practice management. It's really important today, the older model of having an unskilled practice manager, we believe places your practice and yourselves at risk. So qualification is important, and the diploma of practice management or the diploma of leadership in healthcare practice, they're good qualifications to look for in a practice manager. But again, I think there's a component of the practice management role that you don't actually learn in a formal qualification. It really is about that understanding of the patients and the business not being mutually exclusive, and being able to achieve great outcomes in both. So staying connected with your peak body is really important.
Okay, I actually, so just another question of you, if you wouldn't mind. How do I take, I've ran the practice myself, I'm the doctor. What are the roles I can give to a practice manager?
Well, we can go back to my first slide if you want to. I think it's really important in a practice that and we will, what if we do go back to that slide so we can have a look at it? So the scope of practice management responsibilities. So, doctors are clinicians, and currently most of the income into a practice will come as a fee for service, because that's the way our system is at the moment, with change in the air, which is a good thing. But it's really important that clinicians are seeing patients, not only for the patient's health, but for income into the practice. So this list of things here is very much falls within the auspices of the role of a practice manager. Working alongside the clinician, I think co-design is really important. Co-designing systems, co-designing leadership, and business planning. It's really important that the whole team have buy-in to a business plan for it to be successful. Ownership of the goals is really important.
Right. And one last question of you, if you wouldn't mind. All the top 5, here we go, another list, but your top 5 attributes of a practice manager for a specialist surgical practice.
Oh, okay. So to be honest with you, it's going to be top 5 across the board, because the fundamentals of practice management are transferable across any primary healthcare setting. I don't believe it matters whether it's a general practice or a specialist practice or surgery or obs and gynae. I have managed a variety of all myself. My top 5, I guess, risk management for me and risk mitigation is a big one. That's up there with business planning. efficient and safe systems are really important, especially as we move into the digital era and we start to adopt more digital health into practices, making sure that healthcare is delivered in a safe, secure way with all risks mitigated is important. How many am I up to? That was 3 or 4? 4?
I think there's a HR job there somewhere that.
Yeah, high-performing teams. Yeah, high-performing teams, really important to, with teams to lead and manage your teams well, but to be absolutely all over HR requirements in terms of fair work, work health and safety, equal employment opportunity, anti-discrimination. I think as an association, we sat down at one point to count the pieces of legislation and compliance that practice managers deal with, and we stopped somewhere around 300 because it was just getting way too scary. But there is a lot of compliance, and HR is a major part of that.
I do think about the job of a practice manager. In Cutcher Neale, I have a HR manager, I have a marketing manager, I have a compliance manager, I have a technical manager, I have an IT manager. They're all getting ran by a practice manager. So certainly a position with a lot of different hats. So thank you very, very much for your presentation, Cathie. It was very insightful, and as always, I appreciate your contribution.